Welcome to the launch of South Western Sydney Local Health District's strategic plan. I trust before I introduce Uncle Harry to do the acknowledgement to country, I hope you all acknowledge the absolute wonderful facility that we're in today. And this is a fantastic facility for South Western Sydney based in our district, which I think is just fantastic. Arthur Inglis is with us today, clearly a member of the family. It is very special that you're with us, Arthur, but thank you for providing this facility for the people of the Great South West. On that note, I'd like to introduce Uncle Harry to give the acknowledgement to country.
Thank you, Amanda, and it is always a lovely occasion to see you again, and unfortunately, when I see your face, it just wears me out because of all the hard work that I know you are doing. But let me, firstly, let's get on with things, and certainly a good afternoon to everyone. Professor Philip Harris, AM, Board Chair, Amanda Larkin, Chief Executive at South West Sydney Local Health District, the Honourable Chris Patterson MP, distinguished guests, ladies and gentlemen. If I may sort of take your indulgence and just to sort of give you the reason why I'm here doing the acknowledgement to country, it goes back into the dream time. It's a thing that's been brought through, and particularly it's a respect to the traditional owners of each country. I am a proud Gudula person, a descendant of the clans up in the Charters Towers, Townsville area, and although despite the age and the wrinkles in my forehead that I have, I still respect culture. Although I've lived in downtown Chester Hill for over 30 years, I still respect the traditional owners of this land of where we are. So hence, anything when I'm called upon to do these things, I have sort of do the acknowledgement to country. Bearing in mind, I have been passed on stories of the traditional owners, not only of this area, but in many other areas, which I respect deeply. In saying that, I would like to thank South West Sydney Local Health District for inviting me for the acknowledgement of country for today's launch, and the department's recognition of the Aboriginal and Torres Strait Islander nations and clans. It has been through this recognition that has given us all the opportunity to better understand the vast natural and cultural heritage of this wide land. On behalf of the Cabajal people of the Darug Nation, the traditional owners of the land on where we are, and on behalf of those custodians, I would like to extend a warm welcome to you all. I would also like to take this opportunity to acknowledge all our elders, both past and present, who over time have ensured that our culture, history and stories have been passed on for safekeeping to the generations that will follow. As we have all travelled through time, I would certainly like to give recognition to those of you who have joined hand with us to ensure that we continue to move forward on the path to reconciliation. May we continue to move forward with the goodwill that has been passed on to us and continue to respect and listen to each other, being receptive to new ideas and acting wisely so that we can continue to build on this heritage by sharing this knowledge and goodwill with all those that have joined us and embraced our wonderful country. I am sure that if we continue to come together across this great land, that we will all be greatly enriched by the experience and proud to call Australia home. Thank you.
Thank you, Uncle Harry, for those beautiful words. And I did ask Uncle Harry to actually give a bit of background about Acknowledgement to Country. It is a deep-rooted cultural tradition of our Aboriginal and Indigenous people, so thank you for those beautiful words. For everyone, this is a really exciting day for us, and I would like to acknowledge a number of key people who are with us today. Firstly, the Honourable Chris Patterson, State Member for Camden and Government Whip, and we're very pleased, Chris, that you're here with us, and also I know that you're here representing the Minister, so thank you for that. The Honourable Glenn Brooks, the State Member for East Hills, also Glenn, thank you. Professor Phil Harris, Chair of the Board, and members of the Board who are with us today. The Board has given over many years, we're now about 7 years, significant guidance and direction and governance to the organisation, and I sincerely appreciate the support of all of you here today. We also have a number of our key partners with us today, and rather than identifying people individually, if you don't mind, I'd just like to acknowledge a number of key groups. Representatives from Ingham Institute, who we work closely with around research and teaching, and so it's great that you're with us. Our university partners, the University of New South Wales, the University of Western Sydney and the University of Wollongong. The partnerships that we have with you in terms of delivery of wonderful research and teaching here in South West is greatly appreciated, and your support for us today is of course appreciated also. There are also a number of representatives from agencies and services who we work very closely with, and we provide in terms of providing services here in the South West. Ones we've worked with for many years, some of you for over 30 years. So your representation here today, but importantly hearing about where we're going to go as a district from a strategic point of view is highly valued, and I thank you. And I would also like to acknowledge the staff and the senior leadership group of South Western who are with us, who we know, and I'll talk about it a little bit later, are at the core of service delivery and at the core of providing high quality, safe care for our district. I'd just like to make a few opening comments, and also I think probably in thinking about today, I wanted to tell you what I see is the story of South Western Sydney. And the story of South Western Sydney starts with a few key themes. Firstly, it is one of tradition. When anyone thinks about South Western, and I look at Chris and his local government area, which has the largest growth rate in the state at the moment, there is much history though here in South West. We have one of the oldest hospitals here at Liverpool, and we also have another very old hospital down at Bowral. There is significant tradition in terms of provision of high quality care to the community out here in the South West. And whenever we tell the story of South West, we need to think of that picture. Secondly, as I alluded to, it is one of growth, and there is significant growth here. At the moment, the population is about 960,000 people, and it continues to grow, and our colleagues from our local government, and Wendy, it's so great to have you here. As Wendy says, we see people coming to Liverpool, I think about 100 a week. And that tells a picture of the large number of people who are moving out here in terms of the South West, but very importantly, the need for us to be able to grow our health services to meet those needs. So it's one of tradition, of growth, but it's also one of great diversity. Many people have come long journeys overseas to live here in Australia. And here we should be very proud and privileged that many of those people have come to live in our boundaries. When I look at our colleagues from Fairfield, not only the people who have come by choice, but many people who have come as refugees from countries that have been war-torn, it adds great diversity, richness to the communities that we serve, and we're very privileged to give them the care that they need. In terms of the services, though, that we offer services from Liverpool all the way down to the other end. Everyone says Bowral, but I've got to tell you that community goes further. So our services stretch a long way, and they stretch from very high urban communities in the north to rural and semi-rural communities in the south. And the challenge and the great opportunity for us in the southwest, though, is to meet the needs of people who both live in our urban areas that are growing quickly, but also to service and give access to people who need services in the more rural areas. And each one has a priority for us. Each one is important in terms of how we deliver care. Each one is a priority in relation to the quality of care that we provide. So today is an exciting day for us. Today we launch our strategic plan that takes us over the next 4 years and sees the development of some significant services. But it grows on the things that I said to you, on our traditions, on our growth, and on our diversity. We have a huge tradition here of great innovation and great development of services for our community. We want to grow that, and we want to see that grow over the next 4 years to service the growth of population that we're going to see coming into our areas. And we will see that when we ensure that we offer diversity in terms of not only the services that we offer, but ensure we offer great quality research, great quality teaching, and great clinical care. So on that note, I would like to invite Professor Phil Harris to come up and provide some opening comments. Phil has been the chairman of South Western Sydney since 2011. He is currently the Professor of Cardiology with Sydney Local Health District, but has served this district very finely in terms of the advice, direction he's given, not only to the board but to me, but also as we see the development over the last 6 years, he's been very intimately involved and committed to the development of the services here. Phil?
Thanks, Amanda. It's an immense pleasure to be here at the official launch of the 2018 to 2021 strategic plan, and I'd like to welcome you all to this event. I'd like to also acknowledge the presence of Chris Patterson and Glenn Brooks, and to Maurice Yemmer, who's sitting somewhere, the former Premier and Health Minister, and to my fellow board members and all the other distinguished guests. I'll just pick up Amanda's glasses. Otherwise I'll stand on them. It really does feel like the beginning of a new era in South West Sydney Local Health District. The new strategic plan launches us into the next 4 years and clearly articulates our strategic goals, which you can see on the board behind me here. The planning team have worked hard to understand the health needs of our consumers and our local communities, and they've engaged with staff and other partner organisations to develop a plan which focuses our resources in the pursuit of our twin goals of creating healthy communities and providing leading health care. The plan outlines 6 strategic directions which will constitute the framework for our thinking, planning and service delivery over the next 4 years. Delivering safe, high-quality care which is appropriate and timely will continue to be our overriding commitment. We want to ensure that by working in partnerships with our patients, our consumers and carers, the district develops a reputation for clinical excellence and safety. We're also strongly committed to building healthy communities. South Western Sydney is as diverse as it is large. 44% of our residents were born overseas and 51% speak a language other than English at home. Almost 2% of the population is Aboriginal and 1.6% are aged over 65. Over the next 15 years, 1.2 million people will call our region home. In developing the strategic plan, the planning team have tried to develop an understanding of the specific healthcare needs of our population. We will work with our partners to build safe, local communities which support people to lead healthy lifestyles. We'll improve the health and well-being of our communities by developing and implementing programs which empower our residents to make healthy choices. This brings me to our own people, our most important asset. To provide leading care and build healthier communities, we need a workforce which is engaged, positive, and committed to our shared values. Working with us needs to be a rewarding and fulfilling experience. As a district, we must be an employer of choice. We will offer our community the opportunity to train and work locally in a safe, employee-focused organisation which supports the development of careers in health and support services. I said earlier that we're at the beginning of a new era. Through the district's Transforming Your Experience project, we're aiming to truly transform the experience of our staff, their carers and family, and our staff. I should have said patients too. We cannot achieve our strategic goals alone. We need to embrace and collaborate with a large number of important partners. Our fifth strategic goal is to build the healthcare system of the future. First, we need to understand what this will be. This will require close links with our university partners and collaboration with the PHN. To build the healthcare system of the future, we'll certainly need to be a leader in research and technology. Research innovation will place the district at the forefront of advances in healthcare which benefit not only the local area but the nation and perhaps even the world. We're committed to building academic services which attract the highest calibre clinicians and researchers to work in our district. We're looking forward to the expansion of robotic surgery in our theatres and the use of leading technologies such as the molecular science cyclotron facility to fight cancer. I'd like to thank everybody who's worked so hard to bring this important plan to fruition. The board is looking forward to working with all of you to deliver our strategic priorities and to achieve our vision of leading care and healthier communities. And I have to tell you, there is actually a subtext to our strategic plan. And if you look, that you will see it on the back of your bags. It's live, work and care locally. And for us, and for Amanda and me in particular, this means that our aspiration is that everybody who lives in the southwest can work in the southwest and doesn't have to travel any further east than Bankstown Hospital for their care. Thanks very much. I'd now like to invite the Honourable Chris Patterson, the State Member for Camden and the Government Whip, to officially launch the strategic plan. Chris, thanks very much.
Thanks, Professor Harris. I too would like to acknowledge the traditional owners and just thank Uncle Harry for his wonderful, warm welcome. Having been at a number of functions over the years with Uncle Harry, it really is lovely and a great way to start the day, so thank you. I am here representing Brad Hazzard, the Health Minister and Minister for Medical Research, and he gives his sincerest apologies. He's a huge supporter of, well, obviously health, but also south-western Sydney, and would genuinely and sincerely have liked to have been here today, but couldn't because he had another pressing engagement he couldn't change. So Brad does give his sincerest apologies. But he has also said, and quite often you will hear the same acknowledgements a number of times, but he would like me to mention a few people, so I thank you for your indulgence. Obviously my parliamentary colleague, Glenn Brooks, and great mate, it's wonderful to be here with you. Professor Phil Harris, AM Board Chair, Mrs Carolyn Burlew, Deputy Chair of the South Western Sydney Local Health District, and all of the hard-working board members that are here today. Miss Amanda Larkin, Chief Executive, Professor Scott Holmes, Senior Deputy Vice-Chancellor, Western Sydney Uni, Dr Keith McDonald, Chief Executive Officer, South Western Sydney Primary Health Network, Mr Terry Goldacre, Chairman, Ingham Institute, Ms Kirsten Fishburn, Chief Executive Officer, Liverpool City Council, and I note Wendy Waller, the Mayor here. Lovely to see you, Wendy. Mr Sam Sangster, Chief Executive, Health Infrastructure. Mr Gary Forrest, Chief Executive, Justice Health and Forensic Mental Health Network. Ms Lorraine Dudley, Director, Office of Deputy Secretary of Strategy and Resources, Ministry of Health. Like to acknowledge Morris Shemmer, former Premier, former Health Minister, more importantly, current President of the Campbelltown Camden Ghost Cricket Club. Wonderful to have Morris here. Now, I think there was method to the Minister's madness because I've been given a very strict, you have 3 minutes, so the first 2 have just been gone with acknowledgements, and I think it stops me from saying anything maybe I shouldn't. But look, I would like to pick up on a couple of points. Welcome to all those people, and we do mention you because of the role you do play, and it is sincerely appreciated. Amanda and Phil both mentioned Camden alone is the fastest growing LGA in the state. 150 new people a week to Camden. Add Wendy's 100 in, and then in Brooksy's electorate. And if you actually look at what the South West Health District covers, there must be 300 to 500 new people a week coming into this district, which is just unbelievable. So to accommodate that growth, we need the plan that we have before us today. And I'd like to acknowledge the other key point of the plan is that each Premier of the day puts forward a list of priorities. And this plan is not only about servicing the health needs of our community, it's also about delivering on the Premier's expectations. And 3 key elements within her expectations that this plan will go a long way in addressing in our area is improvement to hospital services, the tackling what is the epidemic of childhood obesity, and obviously the delivery of key infrastructure. So with this plan, and you only need to look at the delivery of key infrastructure in the hospitals and hospital facilities that fall under the South West Sydney Health District, we are having nearly a $1 billion injection, with the flagship obviously being Campbelltown Hospital with its $630 million. And it's these plans that give the government the confidence to put that type of investment in the area, knowing that it is going to make a vast improvement to the lives of the communities of which this health district services. So, just to finish, I would like to acknowledge, obviously, Professor Harris, Chief Executive Amanda Larkin, and all of the board for the outstanding job you do. And you do an outstanding job in ensuring that not only the needs of the future current citizens is being met, but the planning for the future, the 500 new people a week coming to all our electorates covered by your health district. And I'd also like to take the time, Amanda, publicly to acknowledge you and the thousands of staff you have, because you absolutely do an outstanding job. Your doctors, your nurses, your professors, your researchers, your cleaners, they do an outstanding job. And when you look at the volume, the sheer volume of what you achieve, it really is an unbelievable and outstanding effort. And I'd like to just say that to everybody here publicly involved in the health system within our electorates. Thank you for your efforts. So it's been wonderful to be here on behalf of Brad, and it's great to be able to launch what is an outstanding plan, a great vision, and something that I look forward to seeing implemented over the next 4 years. Thank you.
Thank you, Chris, and thank you for those beautiful words, because I think the staff really do an enormous job here, and I'll talk a bit about that a little bit later. I'd now like the opportunity to take you on a little video journey around our strategic plan, and yes, you'll see many faces that you know, but it gives a lovely picture of what the strategic plan will deliver for South Western over the next 4 years. South Western Sydney Local Health District was established in 2011. We have a great tradition of innovation and development to meet the needs of this local community. So over the last 5 years, we've seen significant growth in services to meet the growing needs of the community. But we need a plan for the future and we need a roadmap for the future. Our strategic plan sets out 6 key strategic directions to take us forward over the next 4 years.
Our highest priority is delivering safe, high quality care based on the latest clinical evidence. By providing care that is underpinned by the latest evidence and shaped by patient feedback and consumer needs, we will consistently provide care that is safe and of the highest quality.
South Western Sydney Local Health District is committed to involve consumers, patients, carers and other service providers, as well as the broader community, to plan and design health services for the people of our community.
We are in a unique position to establish a healthcare system for the future, with significant investment in facilities and services to meet the needs of the community.
As the General Manager of Campbelltown and Camden Hospital, this is a very exciting time for our staff and our community as we see the hospital go through its $632 million redevelopment. We have seen unprecedented growth in the Macarthur and Campbelltown region, with many young families moving into the area.
Our staff make the biggest difference to the quality of care that we deliver, and they are our greatest asset. The strategic plan sets out how we will create a positive workplace culture, build our workforce for the future needs of our community and become an employer of choice. I love the fact that here in South Western Sydney, I have the opportunity to lead nearly 7,000 nurses and midwives to be the best that they can be in providing safe quality care to the patients and communities that we serve.
South Western Sydney has a long tradition of innovative research that has made us leaders in healthcare delivery. We intend to build on that tradition and take it to a world-class level. In South Western Sydney, there are endless opportunities in research in areas such as robotics, cancer, technology development, opportunities that will attract clinical academics and great researchers into our health district.
We are, in real terms, global leaders in research. And inevitably, when you have such a vibrant group, investment becomes essential.
This is an amazing time in South Western Sydney, a time of significant growth, great innovation and opportunities for significant development. So I hope that actually paints what I think is a really exciting picture, an exciting view around what the next 4 years are going to look like for us. And it's a fantastic time for us to do this. I'd now like to introduce Pierre. Pierre has joined Liverpool Hospital recently as a JMO, a junior medical officer that is. I shouldn't use acronyms. Why did we want to introduce this today? Because one of the critical elements of a big health service like South Western is about research and teaching. There is an absolute obligation on all of us, medical, nursing, allied health and corporate services, to grow people in terms of delivering care into the future. And we want to provide for our young people the best teaching opportunities we possibly can. One of the great values of Pierre is that he lives locally. And one of the things that we've worked very closely with our universities, and especially universities such as Western Sydney, is that people can come to courses, attend university, but then come back and work in the health services that has been so much part of their lives. So on that note, Pierre, I'd like to give you the opportunity to come and say a few words about your experience.
Good afternoon, everyone. My name is Pierre, and I'm one of the new junior doctors at Liverpool Hospital. Now, as someone who has lived, been educated, and worked in southwest Sydney for all their life, I've had the privilege of witnessing how significantly this district has developed in the last 23 years. I wanted to begin by sharing a light-hearted story about my first memory of Liverpool Hospital. I was 4 years old and had been running amok after bath time when my mum noticed a small lump on my groin. Terrified and confused, she rushed me to the emergency department at Liverpool, and it wasn't long before a doctor greeted us. Armed with the shamelessness of a 4-year-old, I responded to his question of, "Why have you come to hospital?" by proudly pulling down my pants in the middle of the waiting room. Needless to say, he was much less impressed by my inguinal hernia than I was. Fast forward to today, and I'm working at Liverpool Hospital as a doctor who, thankfully, has much greater awareness of how to behave in public. I'm often asked why I chose Liverpool, out of all hospitals within New South Wales, to begin my career. In the 19 years since first entering that waiting room, I grew to see Liverpool Hospital establish itself as the largest hospital in New South Wales and one of the leading trauma centres in Australia. I watched as my grandmother recovered from a life-changing hip replacement surgery performed by brilliant orthopods, and I walked with her as she regained her mobility and independence under the careful guidance of physiotherapy and OT staff. I held my grandfather's hand after he was diagnosed with Lewy body dementia in the outpatient neurology clinic and felt the warmth of the nursing staff for him, who cared for him in the palliative care unit in his final months. All of this happened within the corridors of this amazing hospital. I completed my medical degree at Western Sydney University, where I formed a close bond with Narellan Rotary. Now, as many of you know, they have given tremendous support to research at Ingham Institute that is no doubt putting Liverpool Hospital and Southwest Sydney on the map. The ethos of Western Sydney University is grounded in appreciating the unique qualities that shape the health environment of Western Sydney. Throughout my clinical years as a student, I cycled through rotations at Liverpool, Campbelltown and Fairfield Hospital, where I was inspired by mentors who truly care about reducing the health inequality existing within Southwest Sydney. Being the child of Assyrian refugees, I was particularly grateful to witness the hard work of this local health district in addressing the health needs of this growing community within Liverpool and Fairfield. When people ask me why I chose to begin my career at Liverpool Hospital, my answer is thus, very simply, that this place feels just like home. As someone interested in anaesthetics as a career, I'm excited to begin my journey at Liverpool working in the very same emergency department that I first set foot in at 4 years old. It's only too fitting that just last week I was reviewing a young boy with a rash on his chest. Similar to the doctor that saw me 19 years ago, I approached him and his mother in the waiting room. And similar to a young me 19 years ago, he replied to my greeting by whipping his shirt over his head, unfazed by the audience in the waiting room. It's clear that children will never change. However, Southwest Sydney and the climate of healthcare in this district continues to evolve every day. I hope this strategic plan helps to lead us into a brighter and better future for this community, and I'm absolutely honoured to be a small part of this change. Thank you.
Thank you, Pierre. Pierre said, would I like the story? I like the story. I think it's a great story, can I just tell you? So, in concluding, could I just share with you, I hope you've really got a grasp of the exciting time here in the Southwest, and the strategic plan provides the foundation for that development. Before I conclude, though, I want to take the opportunity to thank the planning team under the direction of Simone, who have actually pulled the plan together, and the consultation and input across the whole district, from community through committees that we have, where there was painstakingly discussion around just what the words on some of this might be. And why is all of that process really important? Because we needed something that resonates with us as a district, that sets a platform for us for the future, and instills in all of you a sense of absolute confidence that this is a ship heading forward very clearly and very confidently in terms of the business that we need to do. But at the core of that business is what Chris, you alluded to, and said very openly, which was around the staff. At the core of quality, safe healthcare is the staff who deliver that to people every day, whether it be mum who's struggling with breastfeeding, whether it's the little boy that Pierre's talking about in the emergency department, whether it's looking at our Indigenous population out with Tharawal that we're trying to work with closely in terms of closing the gap. I can go on and give you scenarios of the kinds of work that we do across South West, but at the core of it is this amazing, passionate, committed people who deliver these services every day. And I just want to take a little anecdote. Last winter was for us as a nation, but for us here in South Western, probably one of the most difficult winters we've had to experience. And although the emergency departments are the focus of it, all the health services impacted by that, the condition of the community and the unwellness that's out there. And people on some days can I say to you, rose to the highest levels to continue to deliver care to people. They are the core of this health service. We cannot underestimate the value of the staff that we have both today and we hope through people like Pierre that we attract in terms of the future. So on that note, we wanted to conclude. We wanted to talk about this wonderful group of people who come and provide services every day here. And we wanted to take you on a little journey through their lives of people who've grown up like Pierre here, been educated and have come back to deliver care here. And I hope you will see a number of these people around the hall today. On that note though, at the conclusion of this little video, I invite you to stay. People, please share the opportunity to network and talk to people who you may not see regularly. Share a drink with us and enjoy the ambience of this beautiful facility.